Okay, so good afternoon, everyone. Okay, my name po is Francis Uy on behalf of USEC Manica Intake of DICT. We are here to go through a few of the slides on the Vims Immunization Registry. We are joined po by our colleagues from DICT as well as from our colleagues from DOH KMITS. Thank you po everyone for joining this training session. I'll start po by sharing a few slides and then we will go through a demo session with our trainer, si Jason Martinez, and as well as with Melvin Pitil. And then we'll end po with a few of your questions. So we've summarized some of your frequently asked questions. We'll go through that after this training. And if there are other trainings, you may raise your hand in the Zoom options, or you could type your questions po later in the chat box. Rest assured that we are taking note po of your chat, and so for the questions that we will not be able to answer, we will collate that po and we'll reply and revert to you all on your email addresses. Let me share my screen for a second. Okay, let me just stop annotation. Okay. So the Vims Immunization Registry is going to be the new capability, the new system that we will use for uploading our master lists and our records for the vaccination proper that will be happening in the next few weeks. The Vims Immunization Registry is basically a three-step process. Number one, click on the link that will be provided to your email addresses and download that particular software, install it po, use the login provided to you in the email as well, and then upload that file that you have with regards to the template. For those who will be needing more information, we will be sending you in the email further instructions and later on po the copy of this recording, as well as any other information that you may need, such as the template that we'll be using for the Vims-Ir. Take note that we are using the same templates as CEIR, and we are likewise, for those po who have already uploaded data in CEIR in the past, KMITS from DOH have already sent that file to DICT, and DICT po is in the process of uploading them all into the Vims-Ir database. So as we said, we are going to have 2 more trainings tomorrow and possibly more in the next few days. The schedule po is 10 o'clock and 2 p.m. tomorrow that can accommodate about 1,000 people at a time. Thanks po to our friends from the Asian eHealth Information Network. The link will be sent via the NBOC email address to all of the respective contacts from the hospitals, LGUs, and CHDs. And we'll do the same information campaign po that we have done through Viber. And so thank you so much. We have embedded here below the link to the Vims contact center. Please do SMS or send us an email in the vims.support@dact.gov.ph. Finally, we will be sending po a survey link after this talk and every few minutes, so that we can capture po some very important data with regards to ensuring readiness in your site. So part of the questions we'll be asking is if you will need free Wi-Fi or free internet from DICT in your vaccination location, if you have or have a need for a data capture during the vaccination proper, the vaccination itself. We will also share po any other questions that may be pertinent to ensuring that your site will be a successful vaccination site. Our goal continues to be to vaccinate as many people in the fastest and safest and most efficient way possible. Maraming salamat po. Let me now pass on the microphone to our colleague from DICT, Jason Martinez, to go through his slide deck and to share po the details about Vims-Ir. And again, after that po, we'll go through your frequently asked questions, and we'll go through some of your questions din po, either by raising your hand on the Zoom so that we can unmute you, or through the chat box message. Thank you so much. Jason?
Jason, please check your microphone. It could be, well, it's showing us muted. Um, Francine, you might need to unmute him.
Yep,
In case
have already requested Jason to unmute. Hello, Jason Martinez. Good afternoon. So while Jason po is working on his technical setup, I'm sharing lang po right now the link to the Google form and requesting po sana for all of our attendees to respond either through that. Happy to also receive your email addresses via the chat box, and we will include you po in the email communication. Maraming salamat.
Francis, I got a message from Jason that according to him, is still muted by the host. That would be you.
Yep. So Melvin, he is already able to unmute. Jason is also a co-host now in the meeting.
Still having the problem, still muted. And I actually searched his name. It's showing as mute. Well, I think he dropped, but there you go.
Sige pa, let's wait for Jason to call back.
So while waiting for Jason, we would like to maybe share what's the objective of this training. I think he's ready now. Okay, so we can proceed now. Thank you. Jason, giving you the Zoom meeting to present.
Jason, you're a bit weak.
You have to move closer to your microphone.
Hello.
If you can move closer or adjust, please.
Yes po, nakatapat na.
Jason, we cannot hear you.
Hello.
Yes, we can hear you now.
Okay.
Better.
Okay po. So, good afternoon everyone po. Thank you for attending for this our
Jason, sorry, you're still not very clear.
Okay. Hello.
Francis, I can hear Jason, maybe because I'm using a speaker.
Hello.
But if you can, yes, we can hear you, Jason.
So if you can speak louder, Jason, thank you.
Okay. So, good afternoon everyone po. Thank you for attending this in our second session po for today ng pag-demo po ng ating Vims-Ir. And I'll be presenting to you and walk you through the specific process po na gagawin natin to upload our data in our facility. So I will share po some my presentation. Can you see my screen na po?
Yes.
All right. Okay, I will start. So this is the presentation for the demo ng ating system po ng Vims-Ir. I'll be walking you through these processes po. No? First is we have this Sftp data upload process. So we're going to install, to log in, and to upload. The Vims-Ir solution po is using two platform po. One is yung uploading po ng data, which we are going to use an Sftp client. So we will be requesting you to install this application. So ito po yung isang example ng Sftp client, which is the FileZilla. Or kung meron po kayo na naka-install na Sftp client that you can use, it's either paid or also free na pwede nyo pong gamitin, you can use it po as long as you can connect to our Sftp client po. Sftp means Secured File Transfer Protocol po, na ginagamit natin sa term para mag-connect po into a secure file server po. So, you're going to download this client application. Client lang po ang i-download nyo and not the file server, FileZilla server po. It's only the client that you're going to download po. So, once you have downloaded it, you need to install the application. So, you just agree on the terms and condition, and the usual process of installation is to be followed until you reach this na pag na-install na po siya, you're going to see this screen na po, and you can load na po yung inyong FileZilla client for Sftp upload. So this is the environment of the FileZilla Sftp client for uploading our files. So, you will be given po ng account. Manggagaling po sa Vims-Ir team, and i-email po yun sa inyo. Then, ito po yung host natin. Sa host name natin po, it will be given din po sa inyo kung ano yung gagamitin nyo po na host name. Kasama po yun dun sa e-email. Then, the username, the password, and the port number. Pwede na po namang hindi ilagay itong port number as long as you put an sftp:/ dun sa unahan po ng ating URL. But if you're going to type only yung pong ating URL na ibibigay sa inyo without having this SFTP, basta you put yung port 22 po, and then mag-automatic po yon ay maglalagay po siya ng SFTP dun sa unahan po ng ating host. Then once na fill out niyo na po itong part na to, you just click po yung connect. So once na connected na po, ito pong next slide yung magpapakita po sa inyo. So this is the environment where you are connected na po. So this part, yung may status na directory listing for this folder is successful, and you will see na on this side po, you will see po yung directory listing po, no? Then in this part po, ito po ay tumutukoy dun sa ating local drive ng ating laptop, where you're going to browse yung lahat po ng data na i-upload natin. So in this section, I have choose yung Vims data, then ito yung list of data na pwede kong i-upload. So ito naman pong part na to, ito po yung sa Sftp client natin, no? So once you drag and drop, so you have to drag this to this, and yun po, magsasabi na siya na our file is transferred na po. So I'm going to show you how to do it po. But yung installation po dapat na nagawa na natin, no? So I'm going to share to you my Sftp client and trying to connect to our facility po. So this is the Sftp client that is installed in my computer po. So I'm going to type po yung ating URL, which is uploads.beams.apps.gov.ph. So uploads.beams.apps.gov.ph, and supply yung username po na ibinigay sa inyo. So for me, this is my username. Then the password that is given to you. So that is my password, and here you put the port number. Then hit nyo po yung connect. Yung connect. Yan. So as you can see po, nakikita po ba ng malinaw yung screen ko?
Yes, Jason.
Okay. Baka po kasi may malabo ang mata. Pero yung nandun sa PowerPoint po kanina is the same naman po, the same yung itsura niya na i-present natin. So this is the area where I have this yung data ko. So ito po yung here, I will delete muna po ito siguro. Then try to upload it para makita nyo po yung natin, no? So I'm going to drag this to the other section, doon sa katapat po, adjacent box niya, to upload po. So you just wait until it is uploaded. So dito sa baba, may makikita naman po kayong all files have been successfully transferred. It is a notification of FileZilla po, telling that the data is already uploaded po dun sa ating facility. So once you see this, pwede nyo po i-screenshot nyo for documentation para makita nyo na makita nyo na na-upload nyo po yung data dun sa ating facility. Then, so this is the once na ma-upload po natin dito yan, our application will fetch this CSV file, yung content po nito, and then ito transfer po dun sa ating Vims-Ir for viewing purposes. So I'm going to transfer now on the site where we can view the content of the data, content of the CSV rather. So here, this is the login, no? But I think I need to present muna yung presentation ko para may guide po. So the next step is to view at dun sa yung ating data po, no. So we have this process for uploading of data to our master file po, no, sa master listing. So the process that you're going to do is you have to log in to our site. Then you will be prompted to the exception listing. Then you have to do some editing if there are if there are files or if there are data that is not consistent and need to be edited. So pwedeng tayo, i-process natin yung editing, or you can directly, halimbawa if you are if you are confident that the data are all clean and wala pong maling information on that particular data, you can send it naman po do sa master file. So dito from editing, meron din pong process na you can send it after editing, you can send it na to the master file. So this is the login login page po ng ating Vims-Ir. Then you will be redirected to this exception list. This is this is the window that we're going to see lahat po ng mga data na in-upload natin dun sa ating Sftp file server po. Then yung napakita ko kanina is editing, no? So you have to click po yung yung pencil icon to do some editing, and mata-transfer po kayo dito sa page na to. So in this page, you have to check yung lahat ng data if it is consistent po, So diyan may mga nandito na po yung sample data, and if there are fields na kailangan yung baguhin, is you can change it. So once you are done po with this with editing, you can submit it to the master file by clicking this submit to master file. Then it will be forwarded na po dun sa ating master list po. Ay, sorry. Okay. Eventually, pag na-click niyo po yon, mawawala na po dito sa exception list yung inyong yung data, and it will be transferred na po dun sa ating master file. Okay. So dapat mapunta na po dito yung data natin once you submit it to the master file. So I'm going to show you po yung process na pinakita ko. I will share another screen po. So I'm going to log in muna dun sa ating Okay, so once you are successfully logged into our systems, as I've said, you will be redirected to our exception list. So ito na po yung list na na-upload ko kanina dun sa ating file server. Then I'm going to process, let's say, I'm going to edit yung ilang dito, or I'm going to check before I send it to the master file, no? So you can browse this full information and modify kung alin man po yung natin. So let's say ito pala ay with allergy, so i-click nyo lang po yung yes. Kung kung need po yun, then select nyo po kung ano yung mga allergies niya. So kung hindi pa na-capture agad dun sa nung inyong nung unang upload po ng ating Pero kung kung wala naman at wala pong problema, so you can send it directly na po itong itong data na to doon sa ating master file by clicking this submit to master file. So once it is submitted, so mape-place na po siya doon sa ating master file, but the next window that you will see is the exception list telling na 5 na lang yung records natin. Kanina po ay 6. So meaning the file is already, or the records is already transferred na po dun sa ating master file. So you can check it here sa master file na nandito na po si Atibo Joe. So ito yung pinili ko kanina. So that is for how to transfer the data to master file using the pag nag-edit po tayo. But may isang button po dito. Let's say, sabi ko nga, if you are really confident that this data is true and correct, wala na pong kailangan baguhin, you can use this this button, yung send to master file, para po ma-send na siya directly dun sa sa master file natin. So I'm going to try. I will click this button, then submit record. Okay. Bakit hindi nag-transfer? But it's supposed to be transferred po dito, no? I will ask the kung para i-check siya. Kasi nasa staging po ako yung aking for demo purposes po. So mukhang na-disable nila tong itong send to master file. But eventually, ang mangyayari po is masesend po siya dito sa ating master file po. Okay. Once na ma-click po natin tong icon na to. Then yung isa pa po naman na scenario is I will share po ulit yung presentation ko. Ito naman po ay sa pagma-master list, kaya lang what if gusto niyo po na hindi gamitin na yung natin, yung platform na pag-upload, and you are going to directly encode the data dito sa system po. So ito po yung process natin. You will be on the new record window. Then from the new record, you're going to supply yung lahat ng data or lahat ng information about dun sa ating vaccinee. Then once na matapos natin yon at i-submit, it will be transferred to the encoded record. Then from the encoded record, parang similar po dun sa kanina na from the uploaded file, tinransfer muna natin sa sa exception list. Ito naman po is from new record, tinransfer po na natin sa sa encoded record. Para po may second layer po of verification tayo na before we send it to the master file is ma-verify po natin talaga na kompleto at wala na pong mali doon sa ating record natin. Then once na ito po ay okay na, so doon you can edit, kung ito po ay okay na, you can send it to master file na po. So may para may control tayo before we send it, or there may be time na baka po na need pa po ng ng approval before we send it to the master file. Even if na-encode natin yung data, pero dapat hindi po siya directly agad na masisend dun sa master file. But if it needs an approval to our superior, kasi encoder lang naman tayo, so naandito sa record, ipapa-upload natin yung mga list na yon before we send it to the master file.
That is for the walk-in, right? Kasi baka wala sila sa master list and nag-appear in the site for inoculation, and that the center for the inoculation have the bandwidth to allow yung walk-in patient, then that's the window they can add them.
Yes po. Thank you po, Sir Melvin. Okay, so let's continue po, no? So ito po yung window where we can add the new record. So dito po yung sa register new record na window po. So you have to fill out this at the same din po ito ng fields na meron po yung natin, yung CSV file. So same content po ang natin, ang mga data elements po nitong ating sa registered new record. So once we fill in na po ito, and we submit it. So, mapupunta po siya dun sa encoded record. And then from the encoded record, yun nga, nabanggit natin, kung ito po ay walk-in, so it needs an approval, then saka pa lang po natin siya i-upload once na ito po ay na-approve na. Then, yung action po na to send to master file is na dito po sa yung kulay green natin. You have to, lang po yun, to click this and submit it to the master file. So, yun po ay mapapapunta na po dito sa ating master file. So, I'm going to show you po this process naman po, no? I will go back po dun sa ating screen where I can so, sa new record po ako. So here is the category you have to choose. Yung ID, let's say other ID. Then PhilHealth. So ang po dito is yung mga required required fields ay yun na lang po yung pwede pong yun ang inyong lagyan, but siguro for the yung completeness of the record po, baka mas kailangan po ay i-fill out po natin lahat, no? Okay, so mag-ano lang po ako sample lang naman to. So here, kung yung may condition po, kung baka pregnant po siya with allergies, so no naman. And halimbawa, kung may comorbidities, so you can select po kung ano yung mga comorbidities. Dito rin po, you can select po kung ano po yung mga allergies. Pero kung no, you just select po nung no. And kung may COVID history, or you just specify po kung ano yung date at saka yung classification, kung kailan po siya nagkaroon. Then, yun po, ito po yung kung may interaction po, yes or no, and you have to provide po yung yung electronic information consent po. Then, you have to submit the record. Kulang ba ako? Okay. So, dapat po ay mag-highlight na to, no? Itong submit record. So, once na kompleto na po yan, we're going to submit the record po, no? And then it will be forwarded dun sa encoded record po. So, here. So, ganito po ang mangyayari, no? So, once na ma-fill out natin to, then proceed po tayo dun sa encoded record. Dito po mapupunta yung mga encoded record. Then, if you are, na-approve na natin, okay na po yung, data na ipinasok natin, at na-approve na nga po ng ating superior, then you can proceed na on sending the data to the master list by clicking po itong action natin for sending it to the master list. So it says na record has been submitted. And makikita natin na it will be transferred na po dun sa ating master file. So that is how this Vims-Ir process works po. Sir Francis, I'm done with my presentation po.
Thank you, Jason. Before we go through some of the questions and answers po, let me just go back again to the quick announcement about the survey link that that have been shared po in the chat. If we can kindly request for everyone to answer that. Let me know if you can see what I'm sharing here. Can you all see po yung Vims Immunization Registry? Let me just turn off my annotate. Never mind. Sige po. So again, 3 steps siya. And again, we are recording this session for those of you who are here. We'll send you a copy of the recording so that you can watch it again. And if you have any questions, you can SMS or email po the number below in this slide. Also, the survey po is about us understanding the readiness of the vaccination centers in terms of your internet connectivity, in terms of the process and the systems that you will be utilizing po in the sites. So please, if you can, please answer the survey or send us an email on the chat and we will get in touch po with you. So now let's go to some of the questions and answers. Perhaps you can request Ian to flash the frequently asked questions. And while we're on that po, we received already some questions from you, so we wanted to answer. One question we received po, ma'ams and sirs, is paano kung wala pang PhilHealth ID or hindi pa PhilHealth registered yung aming mga citizens? And so you can leave it blank or you can just put not applicable for now. And during the vaccination site, we will make po the either the I believe there's a plan po for the PhilHealth organizations to set up a booth that can be where the citizens po, for instance, later on po yung mga citizens na walang PhilHealth ID can then go to and register. And so again, if you can please send your email in the chat and or answer the survey that we are posting right now, we will be able to get in touch with you afterwards to send you the copy of the recording. Thank you so much. Okay, so if anyone has a question, you can kindly raise your hand in Zoom para po we can unmute you. Okay, go ahead, sir.
Yes, good afternoon. This is Lieutenant Andanar po from Philippine National Police.
Hello, sir.
Ask lang po namin kasi doon sa process kanina, it's like individual po yung pag-send ng record to the master file. And we are expecting sa PNP kasi we have 219,000 personnel. If we're going to vaccinate everybody, that's around 219,000 record. Do we have to click individually doon sa system po para ma-send to master file? Or meron po yan send to, parang send
Accept
bulk.
all, no? Parang accept all.
Yes, for example. Kasi
Melvin?
talagang tedious po talaga yan na isa-isahin namin yan. In fact, we already prepared the list yung sa Excel. I mean, we have the system to do that. Kung kailangan namin i-send yan manually through FTP, then it's okay. But if we're going to re-edit uli the information doon sa loob para lang ma-check sa exception list, then go to the master file one by one. So parang inulit lang din namin yung proseso na ginawa na namin sa sistema namin. So if maybe sana magkaroon yan ng isang button na send all or accept all or send by batch, kung hindi pwedeng ganung kabultuhan karamihan, it will help a lot po sa amin.
Sir, we agree po.
Service granted, and that's in process on by the time that you will be using this, you will see that button. So, bago pa iisipin niya ng mga tao, naisip na rin po yan ng ating ahensya. We would like to make this as a tool to be convenient to be used for everyone. That's the right thing to do.
Thank you, Melvin. Appreciate that. So, sir, yun po yung yun po ang sagot. Salamat po sa inyong tanong. Okay, we have po si Ma'am Jocelyn Garibay, and then we'll request po si Chris, and then si Alec, and then si Ma'am Ces. Go ahead po. Ma'am Jocelyn, are you able to unmute? Okay, so let's go muna to Ma'am Chris. Are you able to unmute? Go ahead po.
Hello, I'm sorry, I'm just on mobile data, so I cannot place a video. I would just like to ask if the file previously done by the CEIR is in CSV format, will that be the file that we will also drag and drop in the FileZilla? Rinig po ako.
Yes po, Melvin, may I request po for your comments?
Sorry, I request your help, Madam. If we can repeat that, maybe I miss to hear it completely.
Let me say it, Melvin. So the question, Melvin, is the CSV file that is in the CEIR, is that the same file that should be uploaded in Vims-Ir? The CSV.
Answer po is an affirmative. Yes po.
Okay, great. Thank you po.
Sir, meron pa po akong pahabol na question. Well, does it have to be as specific as previously mentioned in the CEIR that the file name would be specific for region and name of facility, or kahit anong file name, sir?
Mas makabubuti po natin sundin yung instruksyon na binigay po sa CEIR para po hindi tayo magkaroon ng problema. Kasi ang ginawa po namin ay sinigurado namin na yung proseso pong dati ng ginagamit, kung paano kayo gumagamit ng template, maging yung mga detalye nandun, ay nandun pa rin po. Pinadali lang po natin ang pamamaraan para sa inyo sa paggamit ng mga window na magagamit nyo na sa pag-upload.
Okay, sir. Sir, last question po. Kasi po, meron na po kaming CEIR account, and you also mentioned that we will be needing an Vims account and password. When will we supposed to expect that, sir? Knowing that the deadline that was given to us was February 15.
Kung meron na po kayong account sa CEIR, expect nyo po na magpadadalhan po kayo ng inyo pong login credential via email. Iyon po ay nakuha namin o binigay po ng ating mga kasamahan sa DOH para tulungan po ang ating mga gumagamit ng CIR na magkaroon din ng access sa Vims-Ir. As soon po na ready na yung email, kasi we are working on the email blast one by one or by batch, you will receive them po on time.
Melvin, today po ang target, no?
Gusto ko sana ngayon na eh. But rest assured po na matatanggap niyo po yung email.
Okay, thank you, sir.
Thank you. Next po is si in my list, no, si Alec Yi. Sir Alec, go ahead po.
Yes, sir. Good afternoon po sa inyong lahat. Sir, ask ko lang po yung regarding sa accounts that had problems during the CEIR phase. There were some cases where our health centers had problems activating their account, where they already filled up the necessary form, they already uploaded their letter of intent, but it even within 3 days, the activation link was not sent yet. So the day came where CEIR was suspended, then the Vims was in motion. So what of those who are stuck in limbo in between activation and activation of the accounts? What will happen to them?
As long as we have po yung inyong information that has been shared to us, but
so Melvin,
we have that in the record.
So Melvin, the question po is for those that do not yet have an account in CEIR, how can they get access?
Okay.
Sorry, if I may add, that is correct. But what they've already done is they've already sent their credentials. They were just waiting for the activation link. So what would happen? What would happen to those accounts when they already submitted, but CEIR was suspended during that time?
I may request po is you raise that concern to the contact center. Valid po ang concern nyo. Kasi your name po, Alex, kung makikita naman po namin sa list na that has been shared to us, hindi po kayo magkakaproblema. Mapapadala po yung inyong account that it's been activated with the password na. So kung wala dun sa list, and if you're still anxious about it, pwede po kayo mag-contact sa contact center and we can help you check kung nandun po. Otherwise, the process po I'll be explaining na is for your facility, we have identified dun sa mga inoculation center kung sino yung mga focal person. What you will need to do is to get endorsement from that person that or that person that has been authorized and have access in the system can send an email to the contact centers endorsing those that needs to be added to the login or user that should be authorized to use the system. So ganun po ang proseso natin. Magpa-endorse lang po kayo o kaya mag-contact kayo sa contact center and then we can help verify po. Salamat po.
Thank you, Melvin. A redundancy po that we are doing because we understand the urgency of or where we are. For those who does not yet have access to CEIR from before, please kindly answer the survey that we have shared on the chat. I'm resharing it again para po makuha po namin ang inyong mga detalye. And we will compile this po for validation, verification either with your hospital official person or with the local government units po.
The information po dyan is yung region, LGU, your name of course, and then the people that you believe are the person that should endorsing you, and also the city as well, so we can check and verify.
So Melvin and everyone, all of that information is in the survey po right now. So please just answer that survey so that we can capture that information. Thank you.
Okay. Thank you very much po for answering the question. And just for clarification's sake, is the deadline for February 15 still in effect?
Sorry, naputol po kayo. Is the deadline
the deadline for February 15, is it still in effect?
Continue sending to us kasi we will not stop naman accepting.
Yes, sir. Understood. Thank you very much.
Okay, thank you. Let me call on now Mrs.
Hi. Good afternoon, Francis and everyone. I just want to ask, doon sa you talked about an exception list. Will there be a highlight of which specific fields are erroneous or invalid? Kasi I think you understand, we have thousands of records, and maybe I don't know how many will go into the exception list. Kasi I'm asking this because when we uploaded in the CEIR, our CEIR data, the only message that we got is all of the records that we uploaded are invalid. So we are clueless, so we have to figure out ourselves which of these fields in every row were rendered invalid.
Okay, thank you, ma'am. That's a very valid concern. The facility po that we provided to the uploader is that it's open. We upload everything that you send out. We don't inform you, or we don't say that your data is invalid, because that responsibility is that we give that doon sa mismo nag-a-upload. So if you believe that your record is clean and nothing needs to be cleaned up, and you think that will help you, not that minimum details you have, go ahead and submit that to the master list. Hindi po namin pipigilan yon. Ang the message or the message that we want to send across is the data you have in there is your responsibility po.
Okay, that's very helpful. Okay, thank you. And I have another question. How many accounts are allowed per hospital to do the upload?
Sa ngayon po, wala tayong particular na limit unless i-request nyo po. Hindi,
Okay.
biro lang po yung ano. Pero wala po sa ngayon.
Okay. And then this session is only for the uploading of the data to the Vims-Ir. We're really after also the systems that will be used during the vaccination itself, because we're preparing already for the vaccination of the doctors and associates of St. Luke's. But we don't know. We are just guessing if there will be a system that will be given to us to use to update the vaccination process or the vaccination details of each vaccinee, or shall we use our own system because we already have something that we can make use of?
Let me say, this is Francis. Let me take that on po. So that is correct. This system is for the immunization registry for the master listing. The system po for the vaccination itself, at the moment, we are still working on a solution to provide to the various vaccination centers. We expect po a rollout potentially of all the systems within baka po 1 to 2 weeks pa. And so we will be working po with the initial list of hospitals that will be starting their inoculation on Wednesday or starting po next week on the solutions po that can be used there.
Okay. Sige. So we just have to play it by ear.
Yes,
Which
ma'am.
comes first?
So, yes,
The
ma'am.
system or the vaccines?
Yes, ma'am. And we'll coordinate po with the initial list of the hospitals that will be where we will be doing our initial vaccinations po for a solution that we can both deliver for our vaccinees.
Oo, kasi it's not just giving us the system. We have to understand it and be trained on it, and to be able to train also the people who will actually do the vaccination or be involved in the vaccination process.
Agree po.
Okay.
So we also need time.
And ma'am, to share po the timing between KMITS, DOH, and DICT, we're looking to deploy some of the systems starting po Monday. So stay tuned po for some communication.
Okay.
Okay,
Makikita
thank
po
you so
natin
much.
doon. Ayan.
Salamat
And then we will
po.
be providing user manual to help our users on how to operate the system. And then that final system that you will see, there will be features that maybe not shown at the moment, but that will become available as soon as we have that ready for you po.
Okay. Maraming salamat po.
Okay, let me call lang po ang next person. We have from Makati Med. Wait, I think Ma'am Hazel Dokuyanan.
Good afternoon po, Sir Francis. Thank you, and thank you po, Sir Melvin. Ang question ko lang po first is, just to clarify, no, yung dinemo kanina will be for the individual entry, but there is a provision for us to upload in batch.
Yes, ma'am, we confirm po. And that is that FTP po, yung FTP Mozilla. Tama ba ako?
Apo.
Ayun po.
Is it one-time batch upload, or pwedeng halimbawa weekly may batch upload kami pag meron kaming i-update doon sa Excel file?
Meron po. And sa akin po, stay tuned po because si DOH po magre-request na once you submit, there will be a certain date na once you submit, that's it. Because that will be used nga po for being able to do demand forecasting. At the same time po, ma'am, ang proseso po na ating in-align with DOH KMITS ay once the hospitals or the rural health units, barangay health units, once they have uploaded their files, that is validated po, binavalidate po siya ng mga LGUs. At once the LGUs po validated, binavalidate po siya ng CHDs. And so every time po that there will be a change, kailangan na naman po siya ulit i-validate ng mga LGUs at saka po ng mga CHDs.
Okay. So sir, tama po ba understanding ko? Ang i-upload will be the vaccinees, meaning those that confirm that they are willing to be vaccinated, or are we going to upload lahat ng healthcare workers namin?
So,
and therefore, yung changes na sinasabi nyo is when they change their mind and gusto na nilang magpa-vaccinate?
So the initial master listing po is not yet for the consent.
Okay.
So the intention po nito is to capture our entire list of our healthcare workers.
Okay.
And yung pong consent, pati po yung pag-check of yung kanilang health conditions, di ba po? Kasi sometimes po sasabihin, wag na muna pa kayo, defer muna kayo. That is done po on the vaccination side. Yun po ang ating guidance that we got from the DOH team.
So yung changes na ina-anticipate natin will be pag may bagong employee or pag merong resigned?
Pwede po,
Hindi
pwede
naman.
po. Mangyayari
Last na
po
lang po,
kasi,
sir.
yes po.
Yes po, sir. Ano mangyayari?
Ang intindi ko po ay you can still change. Ang gagawin lang po kasi ng DOH is magbibigay po sila ng cut-off for for the upcoming batches. May cut-off po yan para po doon sa pag-demand forecast. But in terms of making changes, I think that's okay naman po. We understand that people leave and people join. So that is expected po.
Okay, last na lang po, sir. So the intent of the Vims-Ir is parang registry of the healthcare workers that we have, for example. And then, idudugtong po ba dito yung adverse effect following immunization? Or if we have our own system, will it be uploaded? Kasi we're trying to look at, kasi parang baka next week, halimbawa na, tapos, yun po.
Okay po. Ang maganda po inyong tanong. Ang adverse effect po following immunization, ang ating pong so far official system of record is the FDA system called Digiflow. We are still identifying po kasi po kung kanyo po ay may sistema na sarili ninyo to report that, importante po na makalap din po ng national government ang datos na iyan para po makapag-desisyon po ang ating mga decision makers within DOH and the vaccine cluster if there are particular action steps po that we need to take as a country.
Pero it will not be linked to this Vims-Ir?
No po, because the Vims-IR's purpose po is for master listing. And so in itself, it is not intended to capture any operational data on who got vaccinated, who got the adverse effects.
Sayang, maganda kung... Anyway, thank you very much po.
You're welcome po. Hindi na po namin muna dineploy yung buong sistema ng ecosystem dahil nakafocus lang po muna tayo today sa Vims-IR. Pero meron na rin po tayo mga sistema for the others like being able to capture po the adverse reactions from your various systems. So we will get back in touch po with you on the proper time po for those things. Thank you, Ma'am Hazel. Sir Israelito Kaiko, any questions po?
Hello sir, good afternoon.
Good afternoon po.
Sir, tanong ko lang po sir, kasi po sa previous system yung CEIR, may problem po regarding sa mga barangays. Kasi po di ba ang gamit nila is meron silang coding system na ginamit which is the Global Geographical Code. But kulang po kasi yung data na binigay nila. So meron po kaming missing na 3 barangays before. Although you may na-correct sila, but yung isa po, meron po incorrect din na barangay names. Will we assume na corrected na po ito sa Vims-IR?
Melvin, may I ask po your help on the question?
Sorry, hindi ko. I have to listen again to the question.
Sir Melvin. So, the problem is, sa CIR po, sir, meron po kami naging problem regarding sa mga barangays. Kasi po may mga missing barangays na hindi nila dineclare. Di po ba? Yung Excel file nila is mga drop downs po. So, depending on the city, dyan lang po lalabas yung barangay for that cities. Hindi po complete po yung listings nila.
Bakit hindi po complete?
Hindi ko po alam, sir. Kasi po nung nakita ko, so for example sa Asnabotas, yung ginamit nila is yung lumang barangays. So, previously po kasi, yung meron kami 3 barangays, so Tangos, Tansa, and NDBS, which is nasegregate po sila ng 2017 or 2018. So si Tangos po naging 2 barangay, Tangos North and Tangos South. Si Tansa naging Tansa 1, Tansa 2. Si NBBS po naging NBBS proper, NBBS dagat-dagatan, and NBBS kaunlaran. So hindi po nila na pick up yung complete na set ng barangays.
Okay. So ganito po pagkakaintindi ko sa tanong ninyo. Nagkaroon po kayo ng problema na makumpleto yung inyong record.
Yes po, sir.
Hindi po problema siya ng CEIR.
Apo.
Ganito po, ang sagot na lang is kung na-ready na yung record ninyo, i-load nyo na lang po.
Pero sir kasi po, yun po kasi ginamit namin is yung Excel, di po ba? Which came from sir Amin. So yung pong mismong template hindi po complete. So opo. Although sa system po nag-generate naman namin na bago, ni-ready na po namin yung proper na barangays. Ang tanong ko siguro right now is, kasi po di ba coded siya. So ang format po ng barangay is underscore, yung geographical code, underscore, and then yung barangay name. Sa CIR po. Will we be using that same format, sir, sa Vims-Ir?
Sinunod po natin yung ginamit na template ng CIR po.
Yung Excel.
As long as you follow that po at binigay nyo kay Vims-Ir, maloload po yun. So, and you can send kahit ilan pong file, maloload po yun.
So siguro po sir, babalik po ako sa initial question ko na i-assume po ba namin na tama na yung barangays? Kasi nga po, doon sa template nila, missing po yung barangays na yun.
Sige po. Sir, may I take this po? Sir, ito, I will connect po with you offline. And,
sige po, sir.
To get this resolved po, if we need to update the templates, we will do that po.
Okay. Actually, sir, pwede naman namin gawin kasi po, right now po, meron na kami separate system. So, hindi na po kami naging dependent sa template. So, yung pong barangays na bago, inanagdag na po namin. So, ang concern ko po ngayon is, kapag po ba in-upload namin yung CSV na galing sa system namin, tatanggapin po ba ng Vims-Ir?
Sir, as long po as yung mismong mga fields na sinunod nyo ay pareho po doon sa CEIR template, tatanggapin po siya ng Vims-Ir.
Okay pa, sir. Siguro, itatry na lang po namin din.
Yes, sir. Aabangan ko rin po yung pangalan nyo just in case we need to have a further discussions. Pero ang intindi ko po is hindi po kasing stricto right now si Vims-Ir na
okay po,
lang yung fields na ipapasok ninyo. Ganun po.
So yung fields lang po ang important, hindi po yung content.
Yung order of the fields po ang important.
Apa. So another question po, sir, regarding din sa CEIR. Kasi po, di ba, nag-upload na kami previously. Pumasok sa pre-master list. Sa Vims-Ir po, lalabas po siya sa exceptions list. Tama po ba?
Melvin?
Ang proseso po, natagalan sa pagsagot. Lahat po ng niload nyo, automatic lalabas sa exception list. Gusto ko nga pong baguhin yung pangalan niyan na candidate for vaccination. And yun po yung susunod kasing proseso na isubmit nyo sa master file. Pag submit nyo na, yun talaga ang final na master list nyo ng candidate for vaccination.
Okay po, sir. Thank you po. So that's all for me now.
Sir, thank you so much.
Thank you din po, sir.
Salamat po. Next po is si Bacolod City LGC, Sir Adrian Robete.
Hello, good afternoon. So I have 3 questions, pero yung isa nasagot na. Yung first one, does the system comes with a QR code? Kasi yung dati, the CEIR, meron pa yung QR code system. Pero kanina sa pag-walkthrough ng system, parang wala akong may nakita. Included po ba yun?
Okay, so let me answer that po. So ang purpose po ng QR code ay para po maging efficient at mapabilis ang ating pong pagbabakuna para po hindi tayo mahirapan sa paghahanap ng mga detalye ng particular po na vaccine doon po sa mismong vaccination site. So, depende po sa gagamitin na system natin for the vaccination administration. Doon po magkakaroon ng value yung QR code or yung unique code po na i-assign natin sa bawat citizen. So, ini-intend po namin na mag-assign ng unique code bawat citizen sa ating pong sistema meron po tayong field doon. And ang gagawin po nating coordination for the vaccinations po that will happen likely after February, magagamit po siya ng Vims na system na i-deploy po ng DICT. Samantala naman po doon po sa mauunang 36 na hospitals this coming week, yun po ay pag-uusapan po natin ng hiwalay. Kasama po yung mga representatives of the 36 hospitals. Salamat po.
Okay. Last question na lang po. Kasi right now, I know this is just for the healthcare workers yung profiling natin. Will this same system will be used in the future for the general public?
Ang intention po natin ay the Vims-Ir will be the system po that we will be using for all our master listing. And while we are prioritizing nga po ang healthcare workers, we are likewise requesting na rin ang ating mga local government units to upload ang kanila po mga data patungkol po sa mga senior citizen, sa ating po mga indigent population, at saka po sa ating mga uniformed personnel as possible po.
Okay. So, pwede na po kami mag-upload right now?
Yes, sir.
Actually, we're doing that registration ng general public namin, mga personnel, yes, yung our personnel, mga indigent na citizens and senior citizens. So, hindi po siya namin in-upload ngayon kasi I know this is only for healthcare workers. So, you're saying, sir, na pwede namin siya i-upload ngayon?
Yes, sir. And the way the template naman po is formulated is nakahiwalay po ang mga healthcare workers, nakahiwalay po ang mga senior citizens sa bawat linya po, di ba? Meron pong parang categorization po sa template. So,
Okay.
yes po. Hindi,
Alright.
para po hindi naman namin sila bibilangin sa ating listahan ng mga healthcare workers po.
Okay. Sige. Copy po. Okay, thank you.
Thank you din po. Okay, so next po is si Dr. Heide Baltazar.
Sir, ano po, good afternoon po. I think my question was already been answered by previous questions po ng mga iba pong participants. Thank you po.
Okay, Doc. Salamat po for joining us. Then we have po si Jessie Bakal.
Hello, sir. Good afternoon. Can you hear me?
Yes, sir.
Yeah, sorry. I'm not, hindi po ako from any LGU or any health facility, but I came from UNICEF Philippines. So I was just asked by our immunization specialist on, I'm just pitching in how we can help in collaboration with DOH mates, the ICT, and UNICEF Philippines, how we can work collaboratively in enhancing these beams. Eventually, yung logistics management, may na-mention kanina yung pag-capture ng mga immunization. Nasa chat box po, sir, yung email ko. So I'm just pitching in if we can talk bilaterally with the ICT and DOH mates. Over. Thank you.
So, sir, we are already in discussion with your organization for data management.
Okay.
Definitely, sir, very, very welcome. Thank you for joining us. And we'd appreciate, po, sir, your comments also about how we can improve the deployment, the process, the system, offline processes for all of us.
Yeah.
Every single person counts. Every hand and head and heart counts po. Salamat po ng marami sa inyo.
Thank you, sir. You're welcome po.
Okay. Okay, meron pong workstation. Hello po, Mr. Or ma'am. Okay na po ang aking ina-ask to unmute.
Hello, sir. Good afternoon. I'm John Henry Javillas po from Davao Doctors Hospital. Question ko lang po, kasi dati kasi nag-upload kami sa CIR, dahil ngayon naging Vims-Ir na. So di ba sabi niyo kanina is na-integrate yung data from CIR to Vims-Ir. Tama po ba?
Sir, tama po. Kami po ay nakatanggap ng about 5,000 na files from the DOH KMITs. At ang my understanding po, Melvin, we are in the process of uploading everything right now in the database, no? Since yesterday. Yes.
Okay. Then pagkatapos noon, sir, di ba, ang tanong ko lang po, sir, isang process po ba ng Vims-Ir same pa sa CIR? Like, for example, nag-upload ako ng data ng master list. After doon, di ba may approval pa man yun sa LGU, then sa LGU to DOH Davao. Tama po ba? Same pa rin yung process?
Tama po. Same pa rin po ang process.
So, once na-approve na sa once na-approve na sa DOH ng DOH Davao, di ba, pabalik na, doon ka sa CIR, pagbalik, nandun na yung QR code. Same, di ba, same pa rin dito ngayon sa Vims-Ir. Tama po ba?
So, tama po. Ang magiging difference lang po ay yung pang QR code ay gagawin po namin bago magbakuna at makikipag-communicate din po kami sa inyo para po sa ating scheduling pag-communicate. Ang pagkakaintindi ko po ay ang ating pong magigiting na partner sa DOH KMITS ay mag-o-offer din po ng serbisyo para po makapag-free SMS tayo sa ating po mga citizens.
So bali sir? So bali kasi dati kasi yung pagkasabi namin, di ba, may yung QR code na. So on the day of vaccination kasi meron yung ibibigyan ng DOH Davao ng isang vaccination card with the list of vaccine, kung sino yung mga vaccine, then may katumbas yun na vaccination card. So same pa rin yun or iba ng process doon sa QR code na or sa vaccination card?
Sir, ang intention po natin ay pareho. Wala po tayong babaguhin sa proseso.
Wala babaguhin. So same pa rin, sir. So doon sa Vims-Ir, meron din doon na ano yung na-approve na vaccine na, for example, ako, John Henry Avilles, na-approve na ako ng DOH Davao for vaccine. So automatically, makita ko rin doon sa Vims-Ir yung QR code ko. Tama po ba?
Ang understanding ko po ay makikita ninyo ang unique code ninyo, no? Na naka-assign po sa inyo para po matulungan ng ating pagpapabilis ng pagproseso doon po sa mismong bakunahan.
So instead of QR code na, sa CEIR kasi dati meron yung QR code katumbas. So ngayon, unique code na. So on the day of vaccination site, sir, may mag-assist po ba sa amin taga DICT or wala?
Maganda po yung tanong ninyo. We are aiming po to have DICT representative po to support. Babalikan po namin kayo kasi hindi pa po iyon finalize sa amin.
Sir, question din, sir. Di ba may sinabi kasi na FTP na link? Pwede po ba isend nyo rin sa amin, sir, yung FTP na link for batch uploading?
Sir, question po. Kayo po ba, so meron na kayong access sa CEIR, hindi po ba?
Yes, sir. Naka-upload na po ako.
Sige po. So, right now po, meron po kami nakalap na around 4,500 email addresses from CEIR. Yun po ay, lahat po kayo ay papadala namin ng email para po ma-access din na rin nyo po ang Vims-Ir sa lalo't madaling panahon. At yun, dun nga po, dun sa mga wala pang access, no, ang request ko nga po ay if you can answer the survey that we have posted po sa chat para po we can start to filter, prioritize, and communicate po to you and get approval po on your particular profiles from your respective official authorized people or the LGUs.
Okay, sir. Sir, for the last time po, sir, tanong ko lang po, on the vaccination day, ano kailangan, sir, unit ng IT, for example, mag-provide kami ng computer, printer, para kami na mismo ma-print yung QR code or mag-provide din kayo?
Sir, babalikan ko po kayo. But I really like po your forward thinking. If it's okay po with you, sir, babalikan ko po kayo with your questions. Ang gagawin po namin ay all of these FAQs. At the same time po, we will start po to prioritize po muna kasi ang ating initial na 36 hospitals for the next few days.
Sige, sir. Thank you.
Salamat po. So we have po Caloocan City Health Officer, si Sir Elmer.
Hello, sir. Good afternoon.
Hello po.
Can you, sir?
Yes, sir.
Apo. Yes po. Sir, this is Elmer Geronimo from Caloocan City Health Office. Tanong ko lang po, sir, di ba? Last February 10, Vims-Ir na po ang gagamitin natin as per the ICT. Paano po yung mga na-upload po namin previously?
Sir Elmer, lahat po ng mga na-upload niyo previously sa CEIR ay natanggap na po ng Vims-Ir mula sa DOH KMITS at unti-unti na pong ina-upload, no? Hindi lang po namin, wala pa lang po kaming update kung yung sa 5,400 or 5,000 plus po na files na nakuha namin ay kung upload na po lahat.
Sir, even po, sir, yung mga na-disregard po nila na may problem po na hindi po success yung pagkaka-upload, i-upload nyo rin po sa inyong system?
Kung meron po tayong representative ngayon ng CEIR, i-request po natin kung confirm po natin doon kung napadala po sa ating departamento at matutulungan po namin din upang yung grupo para hanapin in case na wala po doon
Opo.
sa nabigay sa amin.
Sir, ako po
So, sir, okay po. So, yes, sir.
So, kumplituhin ko lang po yung sinabi ni Melvin. Ang amin lang pong ma-upload ay yung ibinigay po sa amin ng CEIR. So, kung hindi po tinanggap ng CEIR yung pong files na in-upload ninyo, siguro po mag-assume po tayo na baka hindi pa po siya nakuha. And so, ang i-request po namin ay pag nakuha na ninyo po ang access sa Vims-Ir, kung pwede pong i-validate po ninyo ng mabilis at kung wala po doon ay ipapa-upload po namin sa inyo.
Okay, sir. So, ang mangyayari, sir, mag-re-upload po kami.
Actually, sir, pwede ba tayong makipag-work offline para po tutukan natin yung particular na question?
Okay po.
Para lang po,
Sige po, sir.
natin yung tanong ninyo. No? Kasi kung sakali nga po na kahit na hindi tananggap ni CEIR at binigay pa rin sa amin yung file, ibig sabihin po nasa amin na po iyon. So,
okay po.
I-check lang din po namin sa ating partners from KMITS about the logic there, no, Sir Elmer.
Sir, may tanong pa po ako, second po. Di ba po, sir, mag-upload kami, di ba, sir, ng data? Sir?
Yes, po.
Na profile. Can we download din po in our part na makakuha po ng master list from the Vims-Ir?
Melvin?
Pwede po. Mag-request lang po kayo sa ating contact center.
Hindi, sir. Kunyari po, Sir Melvin, per facility po.
Per facility, request po. Sa ngayon po, ang proseso natin ay mag-request po sa contact center. Pero maganda po yung inyong suhestyon. Dapat merong facility ganon and hintayin po natin lumabas yun. Yun po ang sasagot ko.
Kasi sir, kasi po sir, ang iniisip po namin sa community, pag vaccination day na po, paano po nawalan ng kuryente, nawalan po ng internet. Dapat po, meron po silang
Sir Elmer, tama po. Maganda po yung ang galing po ng mga tanong ninyo. So, tama po. Lahat po ng listahan ay ibibigay po sa bawat vaccination center. Maghahanda po tayo ng worst case scenario. Maghahanda po tayo ng mga alternative procedures at i-ensure po natin na kung sakaling ang redundancy ng internet hindi mag-work ay may manual po tayo na proseso.
Sir, may tanong pa po ko isa. Medyo late lang po kasi ako nakahook kanina. Hindi ko po alam kung discuss na po to. Di ba sabi niyo po within 24 hours magkakaroon na po kami ng aming username and passcode?
Yes, sir.
Available na po kaya yung pag-upload in bulk?
Yes po.
Available na yun, sir?
Yes, sir. And Sir Elmer, we'll send po a link to the recording for this morning and this afternoon session. Baka na-miss niyo po yung recording po ng demonstration on how to do it ay nandoon po.
Okay po.
Video.
Sige po, sir. Sir, maraming salamat po.
Maraming salamat din po. So, next po is si
thank you.
HMC, si Miss Arlene.
Good afternoon. I'm Arlene Manuel po from Chinese General Hospital and Medical Center. Ang question ko po is if nag-upload kami sa CEIR, would the system with Vims-Ir be able to determine if may duplicate record kaming i-upload ulit from dun sa FileZilla?
Ang intindi ko po, ma'am, about the duplicate records, this is a feature po that we are working towards to have available po immediately or as soon as possible in the Vims-Ir.
So, currently, wala siyang way to validate if duplicate yung na-upload?
Makikita niyo po siya sa listahan, pero for it po to provide you a report kung ilan ba at nasaan ba yun specifically. Melvin, baka po mas better if you are the one who answered.
Nang gawin po natin ang Vims-Ir, gusto po natin maging madali para sa ating mga gumagamit ng sistema na ma-check ninyo yung data since yung nag-upload naman po ang responsible o nagmagamay-ari ng listahan na yon. Para matiyak po na walang duplicate, kinakailangan nyo pong i-check. Kaya po meron tayong facility na kapag in-upload nyo po, makikita nyo again yung inyong data sa exception list. Pwede po kayong pumunta doon sa master list para i-check kung na-upload nyo na po ba yung the same files na yan bago nyo po i-push o i-submit na pumunta sa master list. Kasi yung pong responsibility na malinis yung data nyo, including kung may duplicate, ibinigay niya namin po doon sa nag-upload.
Okay. Kasi nga, kung previously may data na kami sa CEIR and baka lang, I'm not, ano lang, a case, sample lang, and nag-upload din kami ulit sa FileZilla, so baka mag-rumble yung data sa Vims-Ir, mag-doble-doble.
Hindi po magrarambol, magdodoble po siya. Kaya po mas maganda,
tama, magdodoble.
Mas maganda po bago kayo mag-upload, mag-login muna kayo sa sistema, i-check nyo doon sa master list o yung sa exception list na meron na kayo doong file o record. So isa yung pong dadaanin nyo po yan sa ganong proseso.
Okay. Sige po. Maraming salamat.
Salamat din po. May I call po our representative from DOH KMITS? Is this Ma'am Cherry? Go ahead po.
Good afternoon po. Cherry po from DOH.
Ma'am Cherry, hello po.
Yes po. Explain ko lang po yung in-explain niyo pong files. So ang napadala po natin from DOH to the ICT 6,450 CSV files po. Ito po lahat yung mga pinadala po sa DOH through the CEIR, whether po ito ay nire-check o in-accept po ng system. So fresh po. Base po ang ginawa po namin, kung ano po na-receive po namin, pinadala po natin. And then also yung mga nakapag-direct encoding po, pinadala na rin po namin yan sa DICT po last Thursday po. Over.
Maraming salamat, Ma'am Cherry. So Sir Elmer of Caloocan City, nasagot na po ni Ma'am Che ang inyong tanong. At Ma'am Che, maraming salamat po for helping us with all of the data collected from all of the different hospitals po and LGUs. Great. So we have our last person here so far, si Sir Larry Macaraig, VRP.
Sir, good afternoon from VRP Medical Center.
Hello po, sir.
Sir, sa CAIR kasi, kung makikita mo, yung mga na-upload mo na, merong master list doon, you could export to Excel file. So maganda sana ko yung facility ngayon, meron din, so that we could check kung may madodoble ba kaming data. We just need to export to Excel, ano lahat yung napadala namin, then validate itself. Kesa doon sa pupunta kami doon sa exception or master list at doon namin iisa-isahin. Sa Excel kasi we could sort it out, alphabetical, so that we could easily validate alin ba yung doble. Sana magkaroon din tayo ng ganong option to download the CSV master list po. Thank you po.
Sir Melvin.
Nasagot na po natin yung ganong tanong. May isa po nagtanong kung pwede bang mag-download na lang. So alin man po sa manual, mag-request lang po o hintayin po natin lumabas yung sinasabi niyo po na hinihiling na feature to download. Meron po tayo noon sa ating backlog at ibibigay po yon dahil maganda nga pong suhestyon yon. At bago pa lang po ibigay yung suggestion na yan, naisip na po yon ng departamento. Ibibigay po yon. Salamat po.
Salamat po sa katanungan din po, sir. So again, we will have another session po tomorrow, 10 o'clock at 2 p.m. We will be using po another Zoom ID para po 1,000 people po ang makasali. Maraming salamat po. So sir, may tanong ulit. Sandali po. Go ahead po.
Yes po. Follow-up question ko lang po regarding kasi doon sa, I understand na tinatrabaho pa yung mga upcoming features, but those features kasi ay critical. So we may know the possible timeline for that kasi kung sisingilin na rin kami sa opisina namin bakit hindi pa kayo makapag-upload ng ganito karami, there's a possibility na ang sasabihin naming reason is because ganito yung available pa na feature sa system. But if they're going to ask us kung kailan magiging available itong mga critical features, yun lang din po yung tatanong ko kung meron na po tayong timeline na there's a possibility kung kailan ma-implement yung mga critical modules po na ito.
Melvin, IT to IT question ito. Is there a way we can publish our schedule of features and when they will be expected po to be in production?
Okay. Ilag po natin yung tanong na yan at babalikan po natin ang ating mga user on that. At i-announce din po yan as part ng communication po sa inyo. Maraming salamat po.
Sir, ang galing ng tanong niya. Okay, so again, maraming salamat po sa lahat ng inyong mga katanungan. Chris, may tanong po ba kayo, Ma'am Chris MD? Nag-raise po kayo ng kamay. Okay, maybe not. Bago po tayo matapos ngayong hapon, again, maggagawa po tayo ng panibagong mga training programs po tomorrow, alas 10 at alas 2 alas 10 ng umaga at alas 2 ng hapon, at maaari po magkakaroon ulit tayo ng mga training programs in the next week po. So, magre-request po sana kami ng feedback sa inyo. If you can all go to the chat box at pakisagot lang po itong tanong. From a scale of 0 to 10, where 10 is the highest, how likely would you recommend this training to your colleagues? Number 2 ay any improvement po for our future training. Kunyari po sabihin nyo na pwede ba in Tagalog, or pwede ba in Bisaya, or pwede ba kung ano man ng tingin nyo po makakatulong para po ang lesson po natin ay mas ma-improve. Already po from this morning to this afternoon, nag-improve na po tayo, no? By making the fonts bigger for everyone, lalo na po sa mga gumagamit ng cellphone at tablets. So maraming salamat po. Kung makakapagbigay din po kayo ng comments, kung ano po ang maaari nating improve, makakatulong po ng marami iyon para po sa pagpapatuloy ng ating mga training at ng ating pong pagbibigay ng impormasyon sa ating pong lahat. And kung papaari po, kung hindi po kayo na sumasagot sa survey, pakisagot po ang ating Google survey para lang po makuha namin ang current po na readiness ng ating mga vaccination centers in preparation po for the vaccination that we're gonna be having. Magandang hapon po sa inyo. Happy Chinese New Year at happy long weekend din po sa ating lahat. Subalit alam ko lahat tayo nagtatrabaho ngayong weekend. So ingat po kayong lahat.